If you ask what causes the most privacy breaches in a dental practice, it is easy to picture a shadowy hacker cracking an outdated firewall, but that rarely reflects the reality of how data is lost. Attackers do not spend their energy trying to break your network security through brute force. They bypass the technology by targeting human attention instead. A breach usually begins with an ordinary moment. A team member clicks a convincing link, opens a fake attachment. This happens because criminals understand the reality of a modern dental office. Your team is busy, helpful, and constantly working under pressure. Strong software and IT support are important, but they provide limited protection if a trusted insider is tricked into opening the digital door from the inside. This tactic is known as social engineering. It is a method where criminals manipulate people into breaking normal security procedures by exploiting trust. Rather than trying to guess passwords, they use impersonation. They send messages pretending to be a regular dental supplier, a courier, a software vendor, or even the practice owner. The attack moves fast. Criminals rely on catching someone in a rushed moment between patients, where one quick click can grant an outsider complete network access. Modern cybercrime is engineered specifically to calculate and exploit these human interactions. Since human actions lead to most breaches, the team is uniquely positioned to stop them. Employees are frequently called the weakest link in cybersecurity. In reality, the danger lies in leaving employees untrained and unprepared for the tactics criminals use. Providing dental-specific security awareness training transforms passive targets into an active detection system. This training creates a crucial mental pause. Questioning a strange request severs the attack timeline. A single trained employee reporting a suspicious message secures the entire network. Teaching your team what to look for neutralizes the attacker's primary advantage by eliminating the human predictability they count on. This approach is backed by the law. PIPEDA, Canada's federal privacy law, and various provincial health information acts explicitly require organizations to train staff on their privacy policies and practices. Lawmakers mandate this because a static policy binder cannot stop a live social engineering attack. Your team needs to understand how those rules apply to the situations they actually face. Imagine a front desk member receives an urgent email appearing to be from your main dental supplier, requesting an immediate change to payment routing details. A trained team member pauses. They look closely at the sender address, spot the typo, and report the spoofed email through a defined, blame-free process. That single moment of trained hesitation satisfies legal compliance requirements while preventing a potential data breach. A blame-free security culture creates a faster reporting loop and a more resilient office environment. Documented staff training is directly linked to a lower breach risk profile. This is exactly what cyber insurers look for when evaluating a practice for coverage. Consistent training serves as a foundational business asset, protecting both your patient trust and your practice continuity. Technology protects your systems, but it takes a trained team to protect the practice from the human-centered tactics of modern attackers. Train your team today. Implement a documented program to secure your compliance certificates and gather the training records your insurers expect to see. Investing in your team's awareness is a practical way to reduce the burden on leadership and strengthen the practice's daily safety.